Hi, my name is Mariam Abdul Mu'min. I'll be presenting on the Utilization Review Office and what it does, in particular to healthcare and healthcare management. So, the work of the Utilization Review Office is to make sure patients get the care they need, that it's administered via proven methods provided by an appropriate healthcare provider and delivered in an appropriate setting. This should result in high quality care administered as economically as possible and in accordance with current evidence based care guidelines. So, what I had interned was in Jacobi Hospital. I had started interning in the Office of Infectious Diseases and moved on to the Utilization Review Office. And the work of the Realization Review Office is to have a health worker that interacts with the the patient and also with uh, the the payer, most likely the insurance company that pays for this patient, in order to know how to provide this patient with the best care they can while also being economically based, meaning provide not giving unnecessary treatments that the patient does not need, and also making sure that the treatment that this patient is given is top notch. Is just basically that the health care that this patient is given is what's best for him or her. So what they do is just a set of guidelines that these health workers have to follow. Most likely is a nurse who checks these guidelines to make sure that these guidelines are followed in order to know, can this patient be administered into the hospital. I mean, maybe made to stay in the hospital. Is it a stay in? Can the person stay? And if the person stays in, does the insurance company pay? And also, what are the guidelines of the insurance company if such and such disease or if such and such health problem was to occur to such a person? What does the insurance company require for the patients to do, for the health worker to do, in order for the insurance company to pay? So what they will do is is to follow the guidelines, and also if they see that perhaps the patient needs some sort of health intervention, some sort of medicine, perhaps surgery, but they've seen that maybe the insurance company might not want to pay it, so they will call, try to resolve this issue in order to get the insurance company to reimburse for the help, this sort of intervention given to the to the patient. So they interact with the insurance company as well as with the patient to know what the best health the best what should I say, the best intervention to give to the patient. So they also appeal on behalf of the patient to the insurance companies. There are some people in the office who write letters to the insurance companies to making an appeal. Perhaps an insurance company has refused to pay for or refused to reimburse the hospital for the care that a patient was given because of such and such reason. So what they will do is to write appeals and give charts as to the reason why they see that this patient needed the healthcare provided to the person, and why the insurance company should pay for the care that was provided to the customer. They interact with the head of the hospital department as well as insurance companies. So what they will do is most throughout this presentation, I will give examples and also some of my experiences of how they interact with the insurance companies, and also they get to interact with the nurses and also the head of different departments, so that the head of the department will give reasons as to why these patients were given the healthcare interventions they were given, and why they needed it, and why the insurance company needs to pay for what was provided to the customer. So the three processes that I have chosen that are done in the utilization office that promotes healthcare management. One is the prior authorization process. So, firstly, when a patient comes to the hospital, the most likely the nurse or whoever is situated to make sure that he or she stands between the hospital and the insurance company, make sure that they follow the set of guidelines and see what the patient needs to be given according to the guidelines set by the insurance companies, to see if the guidelines set are actually the proper um, set of health intervention they could give to the patient. If they're not, then they will try to get to insurance companies and explain as to why maybe this patient needs such and such, maybe surgery, or why this patient needs this machine or a walker, or or any sort of healthcare intervention that they could give to help this patient. And also, they work as a mediator between the patient and the insurance companies. They send requests, like I had explained, appeals whenever there are any denials, and yeah, basically. And also, they ensure that proper care as well as required care are administered to each patient. So let me give an example. Let's say a patient named Charles came to the hospital. Perhaps Charles was felt his heart beating really fast. So this patient came to the hospital, uh, complaining about maybe chest pain or something of that sort. So the head of the department, most likely a nurse or someone of that sort, will see what does this patient need, which will be the prior authorization process to see. Follow the guidelines that was given. What are the proper intervention to give to this patient, and also follow it according to the requirements of the insurance company that this patient is based in, is using to pay. So they'll follow the process to see, does this patient require this sort of intervention? Should he be given this medicine? Should he be admitted to the hospital? Should he be made to stay in the hospital for 2 days? Or so on and so on and so forth. And they'll also see, is the insurance company in compliance, agree with this sort of health aid that's given to this person, and will the insurance company pay for this? Then after this, at times there might be times where the physician might think that the person needs to stay in the hospital for them to be taken care of, whereas the insurance company disagrees. So stuff like that can happen, and the person might stay in the hospital. And when such things happen, the insurance company or the payer might refuse and not want to pay. So when these happens, the utilization review office will send appeals for the patient, on behalf of the patient, to the payer, which is in this case the insurance companies, asking them why they need to, telling them why they need to pay. So they make appeals on behalf of the patient, asking for the insurance company to pay for the service given to their customer for such and such reasons. So, and they also ensure that proper care as well as required care administered to each patient, like I just said. Sometimes there might be a reason why they might continue giving some sort of aid or medical help to this individual, even though the insurance company might not agree to it. And when that situation happens, then a process that they go through to appeal the refusal of not paying on behalf of on the part of the insurance company. Okay. So what I have chosen in particular, something that's important in particular that they do is they work as a mediator between the patient and the insurance company and the insurance companies. So I work mainly with one health worker. She mostly deals with the appeals whenever there are any sort of denials from the insurance companies not to pay for any sort of health intervention made for the any sort of health aid given to the patient. So they send appeals to the insurance companies explaining why the patient needed that sort of health aid or health intervention